Hi, how's it going? My name's Jeremy. I'm just a level 2 nursing student here at Mohawk McMaster University. Today I'm just going to be performing a head to toe assessment for you. I just wanted to check your wristband before we did anything, make sure you are the person that I'm supposed to be speaking to. Perfect. So, age and your name match up. Sounds good. So, yeah, just before we do anything today, I just wanted to let you know that everything here said and done is completely confidential between you, me, and the healthcare team. Yeah, is that okay? Perfect, perfect. All right. So this entire process is probably going to take about 15 minutes. Do you mind if I just have a seat?
Yep, that's
Yeah. So I'm just going to start off with the neurological assessment. When I'm assessing the patient, I'm going to be checking for the appearance as well as the body movements, making sure the body movements are voluntary. It doesn't seem like she's trying to hold back from any movements or she's making any involuntary movements that she doesn't want to make. In terms of her hygiene, it seems to be intact. Her hair isn't disheveled. Her nails are done. They're groomed very well. And like the clothes she's wearing seem to be like new clothes that are like washed and stuff like that as well. In terms of her behavior, she seems to be acting appropriate to this situation. She doesn't act out of the ordinary for what is appropriate in like normal situations such as this. In terms of her level of consciousness, it seems to be alert and oriented. And in terms of her speech, it's clear and understandable as well. And her mood and affect don't seem to be highly affected today either. Uh, when checking her cognitive function, I'll check that she's alert and oriented times 3. And by doing that, I could ask her multiple questions such as, what year is it today?
It's 2022.
2022, okay, for sure, yeah. And then, do you know the current Prime Minister by any chance?
Yeah, it's Justin Trudeau.
And do you remember what you ate last night?
Ribs.
Ribs, for sure, for sure. Yeah, and so by doing that, I could test for her alert and oriented being times 3, as well as her memory for short term and long term, as well as her attention span when I was speaking to her as well. Yeah, and on top of that, I can check for the thoughts and processes and perceptions and how if she's having like any thoughts that are away from the awareness of reality. And so I could ask, like, do you see things that certain people might not be seeing?
No.
Yeah, for sure. And then I can also check for Perla, making sure that her pupils are equal and reactive to light, and they accommodate for light too. So yeah, click. All right, click. Perfect. Okay, so next I'm just gonna be moving on to the cardiac assessment. Is that okay? All right, so next I'm gonna be checking for the cardiac assessment. So I'm gonna first start off by just checking your radial pulse. Is that okay? Yeah.
Yep.
For sure. And after doing this, I'm also going to be checking for your blood pressure using the blood pressure cuff. After that, I'm also going to inspect your skin color just to make sure that it's normal and even, as well as the condition for it, making sure that it's there's no damage along the skin, as well as no abnormal pulsations that are occurring as well. In terms of that too, I'm also going to auscultate to hear for the aortic pulse, which is in the right second intercostal spot right here. Okay, perfect. And after that, I'm just going to move on to the pulmonic. Right there, right across the left second intercostal space. Perfect. All right, after that, I'm just going to be checking the tricuspid right here, right below. Perfect, perfect. So this is in the fourth intercostal space. And then afterwards, I'm going to be checking for the mitral right underneath. In the fifth intercostal space right there. All right. So when I was checking there, I was checking to make sure the heart rate rhythms were regular and normal, as well as having a normal S1 and S2 sound, making sure the lub dub was strong and normal as well. I also am going to check for your apical pulse. Just give me 1 second. Check it right there. For sure, for sure. Just give me 1 second. Yeah. And what I also checked for there was I also checked for any deep line bruits or any abnormal heart sounds that shouldn't be occurring as well. And I just checked for the rate and rhythm of the apical pulse, which were normal as well. So in terms of your peripheral vascular system, I'm just gonna be checking for the skin and color, as well as just checking for the cap refill. Yep. So the cap refill seems to be working, as well as I'll be checking at the bottom of your feet as well. So I'm just gonna be checking for the pedal pulse, making sure the blood flow is coming down to your feet correctly, as well as making sure the pulse is palpable. Perfect. Moving on, I'm just going to be doing your respiratory assessment. So first off, I'm just going to be checking for your O2. Would you mind giving me your index finger for me, please? Thank you. Clip it on. Perfect. All right, so the O2 saturation machine will capture the O2 for me, as well as the respiratory rate and heart rate for depending on some of the O2 machines. But if not, the respiratory rate, I could check by just setting a timer on the clock for about 60 seconds and not telling the patient to not affect her normal breathing rate, and I can just be checking for how many times her chest actually expands up whenever she's breathing within those 60 seconds to get the respiratory rate. While I'm doing that, I could also check for like the chest shape and symmetry and make sure there's no irregular muscle development that happens on one side that doesn't happen on the other, as well as the color of the chest being like not cyanotic and being of like normal color as well. And in terms of her breathing patterns, I could also be checking for like shortness of breath, as well as shortness of breath on exertion and orthopnea as well. And I also have to check for symmetrical expansion whenever she is breathing. Excuse me. And sorry, when I'm auscultating as well, I'm going to be checking for clear breathing sounds, making sure there's no advantageous sounds, like no cracking or wheezing or anything like that, as well as the air entry being equal on both sides. So I'll be checking in both the anterior view and the posterior view. So would I be able to just check those sounds for you? Perfect. So when I'm starting off at the front, basically what I'm going to be doing is I'm going to start off in a zigzag fashion. I start off from the left, it's just about there, yeah. Breathe in, perfect. Yeah, so this side, breathe in, breathe out. Okay, I'm going to move down just like that. Breathe in, breathe out, perfect. Other side. Alright, one more time, please. Okay. Okay. Alright. Alright. Okay, last one on the first go. Perfect, thank you so much. I'm just gonna do it on the other side on the back as well, in the same exact fashion. Breathe in. Okay, breathe out. Okay, breathe in. Okay, breathe in. Okay. Alright. Okay. Alright, perfect. So when I checked, there didn't seem to be any wheezing as well as noises. So I'm just gonna be moving on to your abdominal assessment. Would you mind if you could lift your shirt up just right up to your stomach, please?
Yep.
Perfect. So in terms of the abdominal assessment, I'm going to be checking in the 4 quadrants, the right upper, the left upper, as well as the right lower and the left lower quadrant, to make sure the contour symmetry as well as the color is correct, as well as checking for any lesions or scars that may be intact. Okay, perfect. And next, after that, I'm just going to be checking for, I'm going to actually auscultate to check the bowel sounds. All right, so I'll start off with you right. Okay. Alright. All right, perfect. So when auscultating, I can hear bowel sounds being active in all four quadrants, which is what we want to be seeing. And next, I'm just going to be percussing and checking for normal tympany as well. So first off, right here. Yep. Okay. Yeah, so the timpani in the all the quadrants seem to be equal and intact as well. And lastly, I'm just going to be doing a last light palpation to check for the tenderness as well as checking for any extra masses, making sure the abdomen isn't soft or anything like that. Okay. Perfect. All right. After checking for those things, I'm going to be asking the patient is series of several questions. So I'm also going to ask the patient just when was the last time you passed gas?
Yesterday.
Yeah, for sure. And then your last bowel movement?
It was this morning.
For sure, for sure. Have you felt any nausea or vomiting or anything like that?
No.
For sure. And how's your appetite been affected?
No, it's been good.
It's been good. Okay, sounds good. All right, so for the genitourinary assessment, I'm going to ask the patient a series of questions. So, in terms of your urine, how's the frequency of your urine?
I just go regularly.
Regularly, okay. And have you been feeling very urgent when you have to go pee or
No.
no sense of urgency? Sounds good. And how about peeing at nighttime? Have you been?
No.
Okay, sounds good. And do you have any dysuria, any pain when you're peeing or anything like that?
No.
Sounds good. And in terms of your urine color, what type of color is it usually?
It's a yellow color.
Yellow color most of the time. And does it have any strong odors to it, or is it just
No, just
an
normal
average sound?
pee.
Sounds good. And then the volume, has it been extra, little? Or?
It's been consistent.
Sounds good, sounds good. And have you been able to control your urinating, or it's been uncontrollable?
I control it.
You can control it, sounds good. And if the patient had a Foley intact, I would just be checking for the urine output, making sure it's greater than 30 milliliters per hour. If it's not, I would have just contacted somebody ahead of me just to let them know that that this is happening and that something should be done about it. Also, I'm just going to be lastly asking the patient to make sure there's no hematuria, which just means if there's any blood in the urine by any chance.
No blood.
Sounds good, sounds good. I'm going to be moving on to the musculoskeletal assessment next, if that's okay with you, yeah? All right, so for the musculoskeletal assessment, I'm going to be checking for your gait and mobility. So I was just wondering if I could ask you if it's comfortable with you to just walk to one side of the room and back, please. Thank you. For sure. Appreciate that. So when she walked there, basically what I was checking for is just to make sure that her spine was straight as well as her gait was intact and correct. And like she wasn't having any difficulties trying to walk from one side to the other, and that her posterior was basically in the alignment of her normal skeletal structures as well, and to check for her normal convex thoracic as well as a normal concave lumbar curve. And next, basically, I'm just going to be checking to see if she has any pain or discomfort whenever I check for the range of motion in all her neck, spine, upper body, and lower body as well. So when I'm checking that, please, would I be able to just hold your arms out like that? Perfect. And so I'm just going to be putting my hands on top. Would you be able to push against them? Yep. And can you do that without them as well? Perfect. Sounds good. So we'll do that on the other side as well. We'll just do it with your wrist this time. Raise your wrist up for me. Perfect. And then down. All right. And then I'm just going to do it with my hands right there. Perfect. The other way for me. Sounds good. Okay. As well as that, I'm just going to be checking for your feet. So, yeah. So, perfect. And then could you put them down for me? And then lift it up with pressure. Sounds good. And then same with your ankles and your feet. Lift it up. Perfect. And then now with pressure. Okay. Alright, I will just do that on the other side as well. Okay, one time with pressure now. Alright, the leg up, please. Okay, down, and then one time with pressure. Alright. Perfect. And then just, would you be able to stand up very quickly? Okay, arms to the side. Could you lift them up for me? Thank you. Just to the side, please, like that. All right, down. And then one more time. Resistance, sounds good. All right, perfect. After that, lastly, I'm just going to be checking for all your joints as well, making sure the sizes as well as there's no swelling or tenderness. and the heat and contour as well as the masses of your joints are intact. All right, so we'll start off with your hands. Sorry about that. All right, perfect. And then I'll go on to your knees as well as your ankles. Okay, and I'll just check your elbows if that's okay. All right. And do you have any pain when you're turning or doing anything with your joints there?
No.
No cracking or anything like that by any chance?
No.
For sure, for sure. And I see that my patient doesn't have any assistive devices as well when she is moving around. And she doesn't have any pain or discomfort when she's moving around, even with resistance to any of the range of motions. All right, next I'm just going to be assessing for your pain as well. I'm just wondering if you do have any pain at the moment.
I don't have any
You
pain.
don't have any pain? Yeah, if she did have pain, I would also be checking, asking about like what makes your pain feel better or worse, as well as if there's any pain with the movement, how it's affected your hygienic care as well. And next, I would also be checking about the quality of pain as well. So just describing the pain as well as seeing if the pain is radiating or if there's a pattern of the pain as well. Just checking if it goes from one place to another, if it just stays in one place, as well as checking the severity of the pain. I can do that by checking for the phase scale as well as asking the patient, on your scale of 0 to 10, how do you rate your pain?
No pain.
No pain, for sure. At its worst, what's the pain?
0.
Yeah, and at its best, what's the pain?
0.
Sounds good. And do you take any pain medication at any time?
I don't.
Okay, sounds good. And if she did take any pain medication, I would check and ask like how it feels after the pain medication, as well as I would ask if the pain is consistent or intermittent.
No pain.
Yeah, and how long the
No
pain would
pain.
have had. Yeah, and in terms of understanding the pain as well, and then reflecting it back to the patient, how the pain management goals of the patient are, as well as including like how it affects the ADLs and how it affects like the patient's daily living, and like what the pain means to the patient. Perfect. And lastly, I'm just going to be checking for the skin of the patient and doing the skin assessment of the patient as well. In terms of the skin assessment, I'm first going to be checking for the dryness as well as the moisture of the skin, making sure that it's not too dry or too moist that like it could affect your skin condition. I'm also going to be checking if you're sweaty, like if there's any extra moisture that would be like unnecessary. Okay, perfect. There doesn't seem to be any bruising around the skin as well. And I'm also going to ask and check for rashes and lesions. Do you have any extra rashes or lesions that I might not be seeing? For sure. And I'm going to be doing a Braden scale check to make sure she's not at risk for forming pressure ulcers or anything like that. So I would be testing at first the sensory perception of her skin, checking to make sure that she's responding like correctly to like pressure related discomfort that she might be feeling, and I would rate that from a scale of 1 to 4, 1 being like limited and then 4 being like no impairment. No impairment. And then next I'll move on to like the moisture, and then just check how often the patient's body is exposed to moisture, 1 being like consistently moist and 4 being rarely moist. After that, the physical activity levels, with 1 being like in bed all day and then 4 being like walks frequently and stuff like that too. And then moving on, it would be the mobility, seeing if they change body positions on the bed often or like in general. So like 1 would be completely immobile and then 4 would be like no limitations to mobility. And the last 2 being nutrition, seeing the food patterns that they take in, and 1 being very poor for those and then 4 being excellent for those. And again, lastly, it would be the friction and the shear that you are getting, and seeing how often like a patient's skin rubs onto something, or like if it doesn't rub at anything at all, 1 being like a problem and then 4 being not a potential problem. Yeah, perfect. Okay, so that concludes our time for today. I just finished the head to toe assessment. Do you have any questions about that? For sure, I appreciate that. All right, thank you for your time today.
Goodbye.